Well, here with us is Dr. Brent Mulliken, her plastic surgeon. And before we see Janet, let's remind everyone what she looked like before her surgery. You all ready to see Janet with her new look?
Welcome, welcome. You look so nice.
I feel like $1 billion.
Now, question for you, Dr. Mulliken. She came in really holding on to that neck of hers going, this is really what bothers me, but you saw her and you added a little bit to that. You did what you like to call your 360 procedure.
You know, I think the face, is kind of a whole picture. We don't just want to have a beautiful neck and then the rest of the face kind of lags behind.
Run us through your patented 360 facial rejuvenation, okay? You started in the neck.
All right, so we're going to start in the neck and make an incision. We're going to tighten the muscles up and do an interlacing technique, kind of like a shoelace for the neck. And that'll tighten that up.
And you like to call this your neck lace. I like that. So you've taken care of the neck. You're moving on to the mid-face.
So now we're going to tighten the skin. But more than that, we don't just want to tighten like we did in the 80s. We want to raise up the deep tissue and take the skin back in a natural direction. So now for the lower eyelids, we want to keep her eye shape, but we want to tighten the skin below the eye. So that's the challenge. So we do a cheek lift, and that elevates the cheek and rejuvenates the lower eyelid.
Not the neck lift you asked for.
So now this is live fill, and these are strips of her own tissue, and they're all alive when they're put in. So we put them into her smile line, into the frown line, and in Janet's case, into the lips as well, just to fill things up. Not buffoonishly, but just kind of subtly.
Right, because we're seeing a lot of that where they go overboard with the volume and people don't look like themselves. Janet still looks like herself.
It's just not pretty if you do
And I
too
think
much.
the key here is that when you're rejuvenating a face, it's not just doing that lifting. You also have to address the volume issue, which you did, and we saw in the video. You also did some laser for the discolorations and the fine lines, and that's how you got such a great result.
Right.
Well, and since this is a show about P words, Janet, look at the camera and smile, because I'm going to do a side-by-side. The proof is in the pudding, as they say, and your result is spectacular. I really am just so impressed with how great the result is.
Thank you.
All right, you got it. All right.
Janet, thank you.
Thank you,
You look
Travis.
fabulous.